Thank you for joining me today. First of all, I'd like to take just a moment to acknowledge all Manitobans that are stepping up and helping other Manitobans during this time of need. We recognize that frontline workers are facing additional and extraordinary challenges during this unprecedented time. And that's why our government will be compensating healthcare workers who are required to self-isolate during this global pandemic. We will be providing administrative leave for those who are asked to self-isolate for the full 14 days because of possible exposure to COVID-19 on the job. Our government is taking action to make certain that healthcare workers are supported during this public health emergency. Notre gouvernement prend cette mesure et apporte cette modification à la couverture d'indemnisation afin de s'assurer que les travailleurs de la santé sont soutenus pendant cette urgence de santé publique. This change will give healthcare workers additional peace of mind in these trying times and provide the necessary time they need to protect themselves, their patients, their co-workers as well. We say thank you again to our frontline healthcare workers. We also want to reassure all Manitobans that they won't lose their job for taking leave to comply with public health orders, to self-isolate, or to seek medical attention, or to care for a loved one because of COVID-19. And that's why today I'm announcing that we are moving forward with provisions to the Employment Standards Code that will allow employees to be protected and to be given protected unpaid leave as well during these unprecedented times. We all have a role to play in flattening the COVID curve, and I thank Manitobans for standing up and playing that role. Together we can and we will beat this thing. Later today, our government will be meeting with Manitoba's public sector union leaders to discuss an all-hands-on-deck approach to fighting COVID. We'll be asking the union leaders to support us in allowing all non-frontline public servants to support and participate in a reduced work week. We believe that this is a common sense approach. We believe that what it will do is allow us to shift resources away from the non-frontline directly to the front line. It'll allow more resources to that front line. It'll allow more protected public sector because it already is in use throughout the private sector. And it's helping keep thousands, tens of thousands of Canadians at work on a part-time basis who might otherwise be facing layoffs right now. I should mention that this makes use of the employment insurance program, which we have paid into as a government over the last 10 years, more than $2 billion in employee and employer contributions funded by the taxpayers of Manitoba. More than $2 billion has gone into that program, and the program is designed for situations such as we now face with this pandemic. It should go without saying that our public service exists to serve Manitobans, and our public servants are dedicated to serving Manitobans too. But right now, the front line of the public service needs our help. And we expect that all non-frontline public servants will want to do the right thing to demonstrate their support for those who are on the front line. Manitobans have every right to expect that their government will do everything that it can to address and support our pandemic response and our healthcare workers on the front line, just as we've done today with the two announcements that preceded this part of my statement. We're asking for all hands on deck. We believe all Manitobans want to be part of addressing the needs of our front line, and I'm asking our labor organizations to be part of that team. We're in this together. We'll get through this together. And to all Manitobans who are doing the right thing to protect themselves and protect others, remember, keep doing that. Not every generation has the chance to save a life, but you do. So keep up the great work. Stay positive, encourage one another, help one another. We'll be back, and together we will beat this thing. I'd be happy to take your questions.
Thank you, Mr. Premier. Just a reminder to our reporters online, you have one primary question and one follow-up question. From CJOB, Diana.
Good morning, Mr. Premier. Diana from 680 CJOB. On the paid leave for healthcare staff needing to self-isolate, who exactly is this for? Is this just for doctors and nurses and that sort of thing? Or will this include people working in hospitals, for example, like cleaning staff, custodians, that sort of thing?
Yeah, it's for all our frontline workers, and when I say frontline, I'm referring to people who make the beds and clean the floors and the washrooms and do the frontline work of protecting people when they're in our facilities. So it's for frontline workers in the healthcare sector.
And just as a follow-up, will this be retroactive? I know we've heard of some cases of healthcare workers needing to self-isolate, and we were told that they had to use vacation days or sick days. Will this be retroactive? Will they be, in fact, kind of paid for those days that they had to take?
My understanding is that this is a go-forward move, but I'll leave the clarity to be offered by others in the healthcare field. Perhaps Dr. Roussin will be able to give you detail on that. But my understanding is this is a change in the program that's going to allow for greater benefits to be made available to all frontline health workers.
From CTV National News, Jill.
Hello, Premier Pallister. How has the reduced work week been received so far, and how much money could you save?
Well, it's a great question, Jill. The meetings that will be happening later today are an effort to work with the public sector union leaders to initiate support for this program so that the federal government will allow us to bring this in. It's already widely in use. You've read, I think, and it's been reported that this program is being used by companies all across Canada right now to help keep people at work, to give them a chance to continue to stay connected with their employer and to continue to provide the services that they do. So we want to see this same situation exist in our non-frontline in our government. Let's face it, we're going to be borrowing billions of dollars this year in response to this pandemic. Rough estimate would say this measure enacted throughout not just core government, but through our crown corporations and so on, might generate about a dime towards the dollar that we would have to borrow. So it doesn't solve all our problems, it's not designed to, but it does give a chance for all of us who are not on the front line to support those who are. And I think that that solidarity is something that many public servants want to demonstrate today.
As a follow-up, Scott Moe said yesterday that, they're basically outlining a plan in Saskatchewan to start reopening the economy. It could come as early as next week. What's the plan here, or is that being discussed?
Sure, numerous discussions are happening, and in fact, coordinated discussions are happening, as well as separate discussions on a variety of issues affecting certain sectors of our economy. That planning is underway. Dr. Roussin will be advising us as we go along because, of course, we have to make sure that our first order of business is to protect the health and well-being of Manitobans, not allow this COVID thing to take off, not allow it, if we do start to bend the curve, to bounce back up again, because this will, of course, defeat the purposes that we've all dedicated most of us have dedicated ourselves to over the last number of weeks. So there are plans to see our economy rebound. We're working very diligently on that. Even yesterday's announcement, for example, which was tremendously well received in terms of the supports for small business in our province, are all designed to assist us in being the resilient province that Manitoba is.
From the Winnipeg Sun, James.
Yeah, good morning. James from the Winnipeg Sun. Just a quick question. With the announcement of meatpacking plant shutdowns, are you anticipating a possible food shortage as the pandemic drags on? And how safe is the supply chain for critical goods?
Yeah, we've all got heightened concerns about safety right now in every respect, not just public health, but as you rightly point out, in terms of our supply chains. Manitoba has some very, very good strengths in terms of the access to transportable goods, services, and so on right now. I wouldn't raise the alarm bells. But obviously, the concern you raise about the meatpacking plants is real, and another one that we need to address in terms of the safety of workers there.
Thank you.
From CBC Radio Canada, Patrick.
Bonjour, Mr. Pallister. Patrick from Radio Canada. About the compensation for health workers, do we have an idea of how much that will cost the province?
Patrick, it's very, very difficult to give an estimate because, of course, we don't know the uptake or the need at this point in time. We hope that by continuing to focus on preventative practices within the workplace, by really focusing, as we have been doing, on the protective gear issue, that these types of things will assist in not creating an environment where there's a greater likelihood of exposure to COVID. That being said, the reality has been that we're erring on the side of caution, that our managers in the healthcare system are faced with, we perhaps don't give them enough credit because they're faced with onerous and unprecedented challenges too, and they're trying to err on the side of caution. So what this program will do is make sure that workers who are in a situation where they're at a heightened risk through demonstrated symptoms, for example, are not going to be punished for taking the 14 days of self-isolation that is necessary to protect themselves and to protect their co-workers and patients as well.
Merci, thank you for that. And do we have an idea of how many health workers that will be?
No, we don't, but we have an idea that it will be eligible. The program is eligible. All frontline healthcare workers, are eligible to receive benefits under the program if need be. Again, we're taking every precaution so that that need is not high. But when it occurs, we don't think that it's fair to allow for a frontline health worker to have to lose 2 weeks of pay to do the right thing and self-isolate. So this program is designed to compensate them, to cover their costs for doing that, and to make sure that they're safer and those around them are safer too.
From CBC Manitoba, Bart.
Mr. Premier Brian Pallister, CBC. Will you be pursuing layoffs if the unions don't agree to the reduced work week?
Well, we're hoping the union leadership will see the wisdom in this approach, Bartley. It is really far preferable to layoffs. As you know, as a government, this week will be our 4th anniversary. We have not resorted to layoffs. We have done our best to help people stay at work, and we have encouraged the civil service to be an attractive place for people to work, and we want to continue to do that. But this is really a win-win in a way, because it will allow our front lines in the healthcare sector to benefit by the additional resources that it will free up. It will allow the taxpayer dollars that have been paid into the programs like the unemployment insurance program to be utilized and directed to the non-frontline workers. And frankly, it benefits the federal government too, because by not putting people full-time on the EI program, it saves them money. So it's a win-win-win in that respect. It helps both federal and provincial governments. It helps the union membership, non-front line, support those on the front line. I guess there's actually a 4th win in this for the taxpayer too, because of course this allows us to recover better and our services can continue to be offered, whereas the option of layoffs reduces the availability of the services, and we don't want to do that.
And to be clear, what has the federal government said to you about the ability for the province to access the funds that you're talking about here?
Yeah, no, we've had good discussion with both the Prime Minister on the call last week, briefly, and of course it's a conference call, so it's not you're not able to get into as much detail as you might like on your individual issues, but I did have a great call with Deputy Prime Minister Chrystia Freeland on this issue. She is looking into it as well, and we're very optimistic because this is not an issue of a legislative change the federal government has to enact. This is, frankly, it's an issue of policy. This is already allowed throughout the private sector. You're seeing many companies, major companies all over the country doing reduced work week strategies to keep their workforce partly employed and compensated partly with the EI program. It's a halfway measure that will result, I think, in positive benefits for all. And so we're hopeful that the federal government would simply, as a matter of policy change, frankly, allow this to go ahead and allow it to benefit Manitobans and potentially other provinces who might wish to follow suit.
From CTV Winnipeg, Jeff.
So, hi, Mr. Premier, Jeff Keel, CTV. So give us a sense of what the reduced work week looks like. Is it 32 hours, or is it like a Film and Friday, or is it less than that?
Well, we're looking to partner with our managers in the civil service and in the Crown corporations, along with the unions, to develop and flesh this out more readily. But I could give you an example, Jeff. Say over the next 4 months, that as we turn this COVID thing and flatten the curve, our civil servants on the non-frontline side can actually work, say, 2 days a week and collect EI for 3. They'd be at about 3/4 of their regular salary through that next 4 months in the middle of Manitoba summer with a lot of them, their kids at home. We don't think that's too much to ask, because then with the savings we derive from that, we can direct them over to the front line. We can support our frontline COVID response teams and the healthcare institutions of our province, get more protective gear. Just that alone, we're getting up to $100 million of additional expense just for protective gear, and that amount's going to go higher and higher. So that gives Manitobans, I hope, a bit of an idea of how this program could work. And what it does is it allows people to continue to work, continue to receive significant pay, and only work for part of the week.
So is 2 days a week the average you're looking at for non-frontline workers? That's what you're looking at, 2 days a week, or would it vary by department?
Well, I just gave you that as an example, Jeff. As I said earlier, I think this is where you need to have a cooperative dialogue with not only with the union leaders, but within your workforce and within your management structure of the Crowns, of core government, of the MUSH sector as well, municipalities and universities. Of course, the schools and hospitals aren't affected by this one directly, but this would allow us to have people still retaining a pretty good percentage of their pay, even though they were working, in this example I gave you, 2 days a week, but it might vary. That is in development as we speak.
From the Canadian Press, Steve.
Yeah, just to follow up on, it's Steve Lambert from the Canadian Press, Premier. Just to follow up on Jeff's question, I assume you've batted around some numbers. You mentioned 2 days a week as an example, but is that what you're counting on, 2 days a week, 3 days a week?
We've looked at various projections. Again, I have to say this is part of the dialogue we need to have, and we need to get acting on this quickly because, of course, let's face it, let's be honest about this. The work demands on a lot of our public sector aren't what they are normally. I'll just be clear about that. So it's not a question of all the offices being open all the time, 24/7 staffed. We're in a pandemic. So people aren't doing the work right now that they normally do. And it's not unfair to say, and public servants have said to me, what can I do to help to support our front line? And so this is a model that would allow our public servants who aren't on the front line to help those who are. That would also show their sympathy for those in the private sector. You just saw the job numbers for last month. They came out late last week. And you saw that well over 95% of job loss is in the private sector, not in the public sector. So here's a chance for the public sector to do something to show its empathy for those who live next door or across the street who are out of a job, and also to show support for their colleagues, their brothers and sisters at the front line of healthcare. I think it's a common sense approach. I think it can help to make sure that we get through this together, and all of us need to do our part. So there's the idea in a general sense, and we're going to pursue it, and we're going to make sure that we do beat this thing together.
And as a follow-up, we're wondering who this covers. When you say not frontline, I assume you're including Crown corporations, the broader public sector, people maybe working in the back of the land titles offices who aren't working the counter. When you say frontline, is it that customer-facing aspect of the job?
Yeah, we're actually going to be developing this strategy in cooperation with our managers throughout all government departments, throughout the MUSH sector. But let's be clear, our public service doesn't have the opportunity to be serving the public right now. And so quite frankly, there's an opportunity here to serve the public in a different way. So taking a small pay reduction over the next couple of months, 4 months potentially, that can be directed to our frontline will assist us. It won't solve all our problems. We're going to be borrowing billions of dollars this year. We'll run a record deficit. It will be the highest of all time. What else will be the highest? Job losses in the private sector will be high. But this is not a proposal to lay people off. This is a proposal not to lay people off in the public sector, but rather to work on a reduced work week basis, free up resources, which can go partway, about 10% of the way we estimate right now, towards addressing the needs of our frontline for additional resources and reducing the need for us to borrow on the backs of our children and grandchildren as we move forward.
From City News, Jonas.
Thank you. Mr. Premier, I'll just follow up on Steve's question there. You think he was asking about MLAs. Will they also be asked to cut back their hours and their pay?
MLAs on the government side have taken, again, without any fanfare, a pay reduction this year. That's the 4th consecutive year that all government MLAs have taken a pay cut, which adds up to around 7.5%. So they are not taking time off. They are working full-time. And I would not put them in the category of frontline healthcare workers. They're not frontline healthcare workers, but they're frontline community workers. And I can tell you that the government MLAs, I can't speak for the others, but I expect they're out there working very hard as well. So these will be the 2 facts I would mention. This is designed to help people get through this crisis who are not working full-time by encouraging them to take a reduction in pay on the basis that they take some time off, and that we can then direct the savings to support our frontline healthcare services that are vital right now and always are, quite frankly, but especially now.
And a quick follow-up for non-public employees, the new announcement today, the protections for them, how much money will be available for them, and I guess how will the codes change and how quickly?
Well, we're enacting these policies now. This doesn't require legislative approval. These are going to be enacted. We have other things planned for tomorrow that will also be benefits to our frontline workers. And here again, the resources we're trying to make available are demand-driven, so I can't give you an estimate. I don't know the demand. I can only tell you that where people need to take time off because they're demonstrating symptoms of COVID or have been exposed to COVID, they will not be punished with a loss of income as a consequence of that. And we think that that's an appropriate way to show our respect and appreciation for our frontline workers, and probably an appropriate way to demonstrate why we need additional resources from non-frontline workers to help to cover those who are on the front line.
From the Winnipeg Free Press, Carol.
Hi, Mr. Premier. It's Carol Sanders of the Free Press. I'm just wondering about all frontline healthcare workers will be eligible to receive. But what about essential service workers who are provincial employees? I'm thinking of grocery store clerks and people who are providing the vital.
Carol, you're clicking in and out on me, Carol. I'll try to answer what I think was your question, and just say the announcements today pertain to frontline healthcare workers and are about making sure that all frontline workers who are asked to self-isolate for the 14 days because of a possible exposure to COVID on the job will be able to get paid administrative leave. If a worker becomes symptomatic with the coronavirus while in isolation, they'll be compensated by their sick leave benefits as per their collective agreement. But if not, then they're going to get full pay for being in isolation for the 2-week period. We looked at what other provinces were doing on this issue, and we felt that this was a step that we could take. Some have taken it, others have not. We felt it was an important step to show our support for our frontline healthcare workers in whatever capacity they might be in.
So there's no plan in place to help anybody who's not public sector, people who are manning the front grocery stores and providing essential services.
Again, Carol, we have some provisions that we're going to be proposing tomorrow that I don't want to tell you about because that's tomorrow when the legislature reconvenes. That may address part of your issue. But again, today's announcement pertains to frontline healthcare workers as I've described.
Thank you.
You bet.
From Global, Brittany.
Good morning, Mr. Premier. I'm wondering if you can tell us which unions specifically that you'll be meeting with today to ask them to look at this shortened work week.
I can only tell you that we actually deal with more than a dozen different public sector unions. All of them will be consulted and talked to today, and we'll look forward to hearing their perspectives on this. We think it's a common sense idea. We think it's a win, not just for frontline members of our public sector unions, but it's a win for those who support frontline members who are not on the front line as well. So we look forward to that dialogue, and we'll be looking forward to getting their perspectives on the issue.
And my follow-up would be, what do you say to people who have maybe had a spouse who's been laid off throughout all of this and now are being asked to look at a reduced work week, possibly a 30% pay cut if it is 2 days a week and on EI for 3 days and have mortgages to pay and expenses to pay? What do you say to them?
I say that having the ability to work part-time and to get paid for 3/4 time approximately or 2/3 time is better than being laid off like their spouse was. I'd be disappointed that any household has to do with less right now, but I'd be surprised if most aren't doing with less right now, right across the province, length and breadth. And 95% of the job losses being in the private sector, I know that it is very important for our public sector workers who are not on the front line to demonstrate not only their solidarity with those who are on the front line through this proposal, but also their sympathy for those, like the example you gave just now, of people who are losing their jobs entirely. We're not talking about having people lose their jobs. What we're proposing is to work with the public sector unions to make sure that isn't the case as much as is possible, that we can keep people working on a part-time basis through this pandemic, even though their workload is very likely in most cases significantly lower, is a logical common sense step to making sure we redirect the resources to the front line where they're needed right now.
From the Brandon Sun, Drew.
Thank you. This is Drew May from the Brandon Sun. Mr. Premier, if the work week does get reduced to 2 or 3 days, what will that mean for service delivery that Manitobans have come to expect?
Manitobans haven't come to expect much service delivery, Drew, in the last few weeks. In fact, with the pandemic underway, people are told to stay home. Our offices are closed. People are working from home for the most part. The workload is significantly down in virtually every aspect of the civil service outside of the front lines, where the workload is excessively growing and where we need to put resources. The resources don't grow on a tree out the back of the legislative building. They come from Manitobans. We're going to be borrowing billions of dollars on our children and grandchildren's future. All I'm proposing here today is a common sense, practical solution so we can keep civil servants at work on a reduced work basis, free up resources to support our frontline workers, and make sure that we're doing everything we can to get through this thing together.
Mm-hmm. And just a quick follow-up, but how long would you anticipate the reduced work week lasting for?
You tell me how long the pandemic will last, I'll tell you how long. I don't know. I hope not too long. I think every Manitoban shares that. But I also understand that we're going to stick to the fundamentals in this province. We're going to make sure that we keep each other safe. We're going to stay home. When we see somebody not respecting their friend and neighbor, we'll say something about it. And now we have the ability, as of tomorrow, to step up with fines and disincentivize this kind of behavior that we've seen a little bit in our province. But for the most part, Manitobans have been stepping up, supporting one another, and the measures I'm proposing today are common sense measures to continue along that theme, to make sure that we're all in this together, that we're doing what we can to protect one another, and that we're making sure the resources that are scarce right now in our province are used intelligently and well. We'll look for these solutions to work, and we'll hope that we're out of this thing sooner rather than later. But the best thing to do is not take our foot off the gas right now. Keep following the fundamentals every single day. On this, I just wanted to wind up by saying thank you to those who called yesterday in respect of our announcement about the wage subsidy program and how we're going to coordinate and assist people in applying for it. But I also want to ask for a favor here. It's going to take 2 or 3 days for us to get this up and running. We have calls all afternoon to coordinate and get ready for this service to be offered to over 60,000 Manitoba small business people and their employees. We're very excited by the response, but here's the problem. We had too much of a response. And yesterday, people were calling 24/7 In Touch on their lines, and 24/7 In Touch is the company that won the contract, won the tender, and is going to be coordinating this. Don't call them. Don't call them because you're blowing out their lines and they have other business to do. Please remember to just wait for a couple of days and then you'll be able to register. If you want to register, go to www.manitoba.ca/supports4business and register online. You go to that web link today. Don't call the company. Go to that web link. Sign up. When you sign up, in the next 2 or 3 days, we will call you right back and our support program will be explained. We'll be able to facilitate you applying. We'll even help you do the paperwork. And we're going to do this because, you know, quite frankly, we're a small business province. And the sooner we can get our small businesses back ready to recover, the better off we're going to be as a province, because our small business enterprises are what employ our children and grandchildren. And they've been the basis of our economy for a long, long time, and they're going to continue to be. But we need to get through this valley together, and so I'm asking you, don't call the company, and forget I ever mentioned it, just don't call that number. Go to www.manitoba.ca/supports4business. Register. If you're a small business owner, if you have questions, please register, and then we will get right back to you as soon as the program later this week is up and running. This is the idea, to help assist you to get through this time, to help assist you to maintain or rehire staff, to help you get through this time so that we can rebound effectively and get our economy back going again. This is how the Manitoba government wants to support you. Our Manitoba Protection Plan has many different aspects to it, but a big part of it is making sure that people have jobs at the end of the day and can continue to work. That's been the theme, I think, of today's commentary from me. So I thank you all very much for supporting us in this effort, and I thank you for your kindnesses, the words of support you offered to one another, to the people in the healthcare field, to the people on the front line, means so much. Please continue to offer those words of encouragement and support. And if there's somebody you've been meaning to call who's alone right now, give them a call. Thank you.